let's talk about the big elephant in the room, man. Medication. With all these, the EpiPen, the I don't know, this bastard, this guy, I don't know, forget his name. Is these people, they're raising these rates, these companies raising rates on medications. Why are they allowed to do this craziness?
Capitalism. I mean, that's the argument they give. There's no law against it. Congress doesn't, I mean, you know, there's no regulation against this aspect. And it's because, like I said, the argument is, well, this is capitalism. You know, somebody else should come out with something else. But the way that the rules are set up, you know, the EpiPen was discovered and created using government funds, like it was a public-private corporation, like they worked together and got it done. But the patent for the medication and for the injector pen for the EpiPen went to the company. And in the environment that we're in now, it's just a giant money grab for everybody. So you look at the EpiPen, they've given away a few coupons, they lowered the price a little bit, and it blew over. You know, they're not dealing with it anymore. But in reality, like people like me, I have a son who has allergies. I have to get him 2 EpiPens a year, one for the house and one for school. And even with the decent insurance that we have, that wasn't cheap. But you got a lot of families out here paying $200 a pen, and you have some schools forcing parents to send the pens in, and if they don't, then the kids can't go to school. It's like, well, I don't have $200 to buy a pen. Now my kid can't get an education?
You know, that whole idea that capitalism should be in healthcare, man, we need to get rid of that. But when you bring it up, people say socialism, exactly. You know,
and ignore the fact that it surrounds them in many other aspects of their life. I mean, when you call 911 and the police or the firemen show up, that comes from your taxes. That's a socialist program. Right. Do you have a problem with that? No, of course not. It's just it's the way that we've been raised and brought up to understand what our healthcare is. And, you know, we got to get people away from that old thinking and understanding that everybody deserves to have healthcare, not wellness care when you're sick, but to actually be able to see the doctor routinely. Because in the short term, yes, we're spending more money, but in the long term, we are saving so much money. You know, if we can catch these Americans before they become diabetic, because we're testing them, we're talking to them about dietary changes, that saves us millions of dollars a year. I mean, billions of dollars over a decade. But again, nobody wants to give the physicians and the providers the time to sit with their patients and talk to them and see them routinely.
Right.
It's just about, we're going to give you enough to keep you going and keep your wallet open. And that's what needs to be talked about, and that's what needs to be changed.
You know, back to the prescription, you know, like, you know, I know there are older people right now who take medications that are so expensive. That's the only reason why they keep working. They're working past the age of retirement because they'll lose their insurance. There you go. Exactly. They call into the show. They tell me this.
We would have people come into the ER who were halving their meds, so they were cutting their pills in half because they just think that there's going to be some benefit in it and have it last longer for them. But they keep coming back into the ER because it's not working. And then when they come back into the ER because it's not working, they're losing their jobs or they're getting in trouble at work. So they have a job to pay for their meds, but it's not enough to pay for their meds. So they end up in the hospital because they get sick, and then they lose their job. And this is the circle these people are living in. So many people live in that awful, disastrous, destructive circle, just trying to live till tomorrow.
Wow. You know, that's a worse analogy than I'm used to. I'm used to hearing about the poor person that has to continue working for no other reason than to get medication. But now you can be doing that, but not making enough to actually cover the medication.
Exactly.
Gosh,
and then you lose your job because you end up in the hospital.
Because dosage matters. You can't just
dosage. Absolutely. Now, is there some medications like pain medicine where you could do things like that? Yes, absolutely. But you shouldn't be cutting your blood pressure medication. You know, you shouldn't be cutting your cholesterol medication. You're going to end up with a heart attack or a stroke or a pulmonary embolism. I mean, there are things that it's okay with, but all of these things you should always talk to your doctor about. And if you can't afford your medications, talk to your doctors, because sometimes there are programs that they can offer you to give you cheaper medications.
And that's the thing about medications. I'm glad you brought that back, man. When they say capitalism and they're talking about competition with medications, it's not like you can just put out a medication immediately to compete with, say, the EpiPen. it has to go through approvals through the FDA, and
Exactly.
it's not like something you could just jump out and say, okay, well, you're right, EpiPen's too much, let's just put out something else. They can't do
Right.
that, right?
No, they can't. I mean, the good thing about the EpiPen is essentially it's adrenaline. And I know a lot of people did try to build and create alternatives, and they can't, because the patent itself for that EpiPen company that everybody was mad at, the patent was actually just for the injector kit, how they
How
deliver the
it's
medication.
delivered it. Gotcha.
Correct. But that really, when you're looking at lay people who don't have medical backgrounds, who don't really know what to do, the fact that you can just take the top off of that and stab somebody in the legs through the pants has saved a lot of lives. But if the option is I pay $600 for an EpiPen, or 200 or 100, and my kid doesn't eat lunch for a month, but at least I have the pen, or you don't have the pen and he eats lunch and he has an allergic reaction and dies, that's a problem too. We're putting American families in between a rock and a hard place like never before, because now it's not just about me and you. It's about, what are we going to do for our kids? What are we going to do for our parents? Because our parents can't afford a lot of this. Our kids can't work. And we're really having to take care of two generations, I think, heavier than since probably the 30s. I mean, we really are responsible for the family, not just ourselves, our wives, our husbands, or kids, but even outside of our parents, our grandparents. My grandfather just passed away recently. He was 95, long, great life. But I mean, these are the things that we're having to worry about. We're making less money every year. We're paying more for the services and getting less. I mean, we're all getting nickel and dime to death in every avenue, and our medications are the one place in our healthcare that shouldn't be happening.
Right.
I'll pay $1 more for my cable internet every year, or $100 more, but
I love
let
it.
me have my medicine. Let me see my doctor.
Yeah, raise the price on the internet if you have to. I'd hate for them to do that, because that'll hurt me. But yeah, I'd rather see that happen, or even gas forbid, what I mean, as opposed to healthcare for people, because that's a totally selfish thing for someone to rather people die, than to lose a couple bucks on that. But